Squeeze this muscle 10 times a day and protect your prostate. After 50, there is a muscle in your body that you have probably never consciously engaged in your entire life, and yet it sits in a position to influence nearly everything happening with your bladder, your prostate, and your sexual function after 50. You cannot see it. You cannot flex it in a mirror. Most men go their entire lives without ever being told it exists, let alone shown how to use it deliberately. And yet this single muscle group, engaged correctly just 10 times a day, has the potential to meaningfully change how your prostate feels, how completely your bladder empties, and how much control you have over urgency and leakage as you age. I am Dr. John. I am a urologist. And today, I want to walk you through exactly what this muscle is, why it matters so much for your prostate specifically, how to find it and engage it correctly, because most men who attempt this get it wrong, and the precise daily routine that produces measurable results over time. Let me start with the muscle itself, what the pelvic floor actually is, and why almost nobody understands it. The pelvic floor is a broad sheet of muscle stretching across the base of your pelvis, running roughly from your pubic bone in front to your tailbone in back. Think of it as a supportive hammock, cradling your bladder, your prostate, and your rectum from underneath. It is not a single isolated muscle, but a coordinated group of several muscles working together, and it performs jobs you have relied on every single day of your life without ever thinking about it. It supports the weight of your pelvic organs against gravity. It plays a direct role in your ability to start, sustain, and stop the flow of urine. It contributes to sexual function, including the strength of ejaculation and the rigidity of erection. And it works in coordination with your bladder and your urinary sphincters to give you the voluntary control that allows you to decide when and where you urinate, rather than your bladder making that decision for you. For most of your life, this muscle group did its job quietly and automatically, without requiring any conscious attention from you whatsoever. That changes for a specific and well-understood reason after 50. Why the pelvic floor becomes so directly relevant to your prostate as you age. Here is the connection that almost nobody explains clearly, and it matters because understanding the mechanism is what makes the exercise itself make sense rather than feeling like an arbitrary instruction. As the prostate gradually enlarges with age, a process affecting roughly half of men in their 50s and a rising majority of men in their 60s and 70s, it presses inward against the urethra, the channel running directly through the center of the gland and carrying urine out of your body. That narrowing requires your bladder to work harder to push urine through a tighter channel, and it requires more effort and coordination from the surrounding pelvic floor structures to manage the flow, the start, and the stop of urination day after day. Over years, this sustained extra demand on the pelvic floor produces one of two opposite but equally problematic outcomes, and most men experience some combination of both depending on the specific muscle fibers involved. The first outcome is weakness. Certain components of the pelvic floor, particularly those responsible for voluntary control and the final stopping of flow, can gradually lose strength and responsiveness from chronic overuse and the natural effects of aging on muscle tissue generally. Weakness in this area shows up as dribbling after urination, a sense of reduced control over urgency, and in some men, mild leakage, particularly with coughing, lifting, or straining. The second outcome, and the one almost nobody is told about, is chronic excess tension. The daily effort of pushing urine through an increasingly narrowed urethral channel, the repeated straining many men unconsciously adopt to start or maintain their stream, trains the pelvic floor into a state of habitual tightness that it never fully releases, even at rest. This chronic tension does something specific and directly relevant to your prostate. It elevates pressure within the pelvic region surrounding the prostate gland itself. That elevated pressure can impair the local blood circulation the prostate depends on for healthy tissue function, and it maintains an ongoing activation of the nervous system pathways that keep the smooth muscle in the prostate and bladder neck in a more contracted state, adding mechanical resistance to urine flow on top of whatever resistance the enlarged tissue itself is already creating. This is the part that surprises most men. A pelvic floor that is too tight is not protective. It actively compounds the very urinary symptoms you are trying to address, and it does so through a completely different mechanism than the weakness most people assume is the only possible problem. This is precisely why the correct pelvic floor practice for men over 50 is not simply about squeezing harder or more often. It involves both strengthening the muscles responsible for voluntary control and deliberately releasing the chronic tension that builds up elsewhere in the same muscle group. Doing only one half of this equation, which is what almost every man who has heard of Kegel exercises ends up doing, produces incomplete and sometimes disappointing results. Why most men get this exercise wrong from the very first attempt. If you have ever heard of pelvic floor exercises before, you have probably heard them described simply as squeeze the muscles you would use to stop urinating midstream. That instruction, while not entirely incorrect, leads the overwhelming majority of men straight into the most common mistake in this entire practice. When given that instruction, most men respond by clenching their buttocks, tightening their abdominal muscles, and squeezing their inner thighs together. None of that activates the pelvic floor specifically. It activates a collection of large, easily noticeable muscles surrounding the pelvic floor while leaving the actual target muscle group either minimally engaged or entirely uninvolved. This matters enormously because if you spend weeks or months performing pelvic floor exercises incorrectly, engaging your buttocks and abdomen instead of the actual pelvic floor, you will not experience the benefits this practice is capable of producing, and you may reasonably conclude that the exercise simply does not work for you. The exercise was never actually being performed. Here is how to locate and engage the correct muscle group with precision. The most reliable way to identify the pelvic floor correctly is to imagine you are trying to stop yourself from passing gas while sitting in a public place where that would be embarrassing. Notice the specific sensation that produces. It is a subtle inward and upward lift occurring deep in the pelvis, distinct from any tightening in your buttocks, your thighs, or your abdominal wall. That inward-upward lift is your pelvic floor engaging. A second reliable method, particularly useful the first few times you attempt this, is to imagine you are midstream during urination, and you need to stop the flow immediately. The muscular action required to do that, performed when you are not actually urinating, isolates the same muscle group. The critical test for whether you are doing this correctly is this. Place one hand flat on your abdomen and one hand on a buttock while you attempt the contraction. If you feel either of those areas tightening or hardening noticeably, you are recruiting the wrong muscles. A correctly performed pelvic floor contraction should produce minimal to no perceptible tightening in your abdomen or your buttocks. The sensation should be isolated, subtle, and located specifically in the deep pelvic region. This takes most men several attempts and sometimes several days of practice to genuinely isolate. Do not be discouraged if your first few attempts involve some degree of unwanted recruitment of surrounding muscles. This improves rapidly with deliberate practice and attention. The complete daily routine. 10 contractions, performed with both strengthening and release. Now that you understand the muscle and how to find it, here is precisely how to use it 10 times daily in a way that addresses both the weakness and the chronic tension components I described earlier. Each of your 10 daily repetitions should follow this specific structure rather than simply being 10 rapid squeezes performed in a row. Begin by engaging the pelvic floor with that inward, upward lifting sensation, using a moderate level of effort rather than your maximum possible intensity. Hold that contraction for a full 5 seconds, breathing normally throughout rather than holding your breath, which is a common mistake that increases abdominal pressure and works against the exercise's purpose. After 5 seconds, release the contraction completely and deliberately, allowing the muscle to fully relax and soften for a full 5 seconds before beginning the next repetition. That complete 5-second release is not a passive pause between repetitions. It is an active and essential half of the exercise. This is where you are specifically addressing the chronic tension pattern that builds up in men managing years of urinary obstruction. As you release, consciously allow the pelvic floor to drop and soften, rather than simply stopping the contraction and waiting for the next one. Many men, once shown this distinction, described noticing for the first time that they had been carrying a low background tension in this region that they never knew was there until they deliberately released it. Perform 10 of these complete 5-second contraction, 5-second release cycles once daily to begin with. The entire sequence takes under 2 minutes. Many men find it easiest to build into an existing daily habit, performed lying in bed before getting up in the morning or seated quietly for a few minutes in the evening. As you become comfortable correctly isolating the muscle and performing this sequence, you can progress to performing the set twice daily, once in the morning and once in the evening, which several clinical studies on pelvic floor training in men with urinary symptoms have used as a more intensive protocol with stronger documented results. What this specifically does for your prostate and urinary symptoms, and what the evidence shows. The strengthening component of this practice directly improves the function of the muscles responsible for voluntary urinary control, the muscles that allow you to stop your stream completely, prevent dribbling after urination, and reduce leakage associated with coughing, lifting, or sudden movement. Over weeks of consistent practice, this produces a tangible sense of having genuine, deliberate control over your bladder, rather than feeling at the mercy of urgency that arrives unpredictably. The release component addresses the chronic tension pattern directly. By deliberately and repeatedly practicing full release of this muscle group, you train your body out of the habitual, low-grade tightness that years of straining against urethral narrowing has likely built into this region. Reduced chronic pelvic floor tension is associated with improved local circulation to the prostate, reduced background pelvic discomfort that many men experience without ever attributing it to this specific cause, and a measurable reduction in the functional component of urinary obstruction that exists independent of how enlarged your prostate physically is. This last point deserves emphasis because it explains why two men with prostates of similar size on imaging can have dramatically different symptom severity. A man whose pelvic floor carries significant chronic tension experiences additional functional resistance to urine flow on top of whatever physical obstruction his prostate enlargement is creating. Releasing that tension does not change the size of the prostate, but it can meaningfully reduce the overall resistance the bladder has to work against, which translates directly into a stronger stream, more complete emptying, and reduced urgency. Clinical research examining structured pelvic floor training in men with lower urinary tract symptoms related to prostate enlargement has found measurable improvements in urinary symptom scores and quality of life measures with consistent practice. This is not a replacement for medical evaluation or treatment when your prostate symptoms are significant, but it is a genuinely evidence-supported component of a comprehensive approach to managing those symptoms. When to expect results, and what the realistic timeline looks like. I want to give you an honest picture here, because pelvic floor training does not produce the immediate, dramatic change that some other interventions can. In the first 1 to 2 weeks of consistent daily practice, most men report becoming more aware of this muscle group in everyday life, noticing moments of unconscious tension during the day that they previously never registered, and developing a clearer sense of when they are unconsciously straining during urination. Between 2 and 6 weeks of consistent twice-daily practice, men typically begin noticing tangible improvements. Less dribbling after urination, a somewhat stronger and more controlled stream, a reduced sense of urgency arriving without warning. Some men also notice a subtle reduction in a background pelvic discomfort or heaviness they had simply accepted as normal for years without recognizing it as connected to muscular tension. Beyond 6 to 8 weeks of sustained practice, the improvements tend to consolidate and become a stable, durable feature of daily function rather than something requiring conscious effort to maintain. At this point, the correct contraction and release pattern has typically become familiar enough that maintaining the practice requires minimal ongoing attention. This is, like nearly everything else, genuinely effective for prostate health, a practice that rewards consistency rather than intensity. 10 correctly performed repetitions daily, sustained over months, will produce results that a single enthusiastic but brief attempt never will. A few practical notes that will help you sustain this. Quality matters considerably more than quantity here. 10 correctly performed contractions, with genuine isolation of the pelvic floor and a complete, deliberate release after each one, will accomplish more than 50 rushed repetitions performed with poor form and incomplete release. If you find yourself unable to isolate the muscle reliably after several days of attempting the methods I described, it is entirely reasonable to bring this up with your physician or ask for a referral to a pelvic floor physical therapist, a specialist who can use direct feedback techniques to confirm you are engaging the correct muscle group. This is a legitimate and increasingly available resource, not an indication that you are doing something wrong by needing the additional guidance. This practice complements, rather than replaces, the other evidence-based approaches to prostate health, including adequate hydration timed appropriately throughout the day, regular movement to support pelvic blood flow, and the dietary patterns that influence the inflammatory processes connected to prostate enlargement. None of these approaches works in isolation, as well as it works in combination with the others. And finally, the symptoms that should prompt a medical evaluation regardless of how diligently you practice this exercise. Blood in the urine at any point, a sudden and dramatic change in your ability to urinate, pelvic pain accompanying your urinary symptoms. These deserve prompt medical attention and should never simply be managed through pelvic floor exercises alone. Annual PSA testing and prostate evaluation after 50 remain essential and are not replaced by any exercise routine, however beneficial. Bringing it all together. The muscle most men have never consciously thought about in their entire lives turns out to be one of the most directly relevant structures to how your prostate feels and functions as you age. 10 repetitions a day, performed with genuine attention to correctly isolating the muscle, holding the contraction fully, and then completely releasing it, addresses both the weakness and the chronic tension that years of managing urinary changes can build into this region. It costs nothing. It requires no equipment. It can be done lying in bed before you even get up in the morning. And it is one of the few interventions in this entire conversation about prostate health that you have complete and immediate control over, starting with the next 10 repetitions you choose to perform correctly. This is Dr. John. Find the muscle. Use it deliberately. Your prostate will notice. I will see you in the next one.